Hi, my name is Tamara. About 2 years ago I broke my back and injured my spinal cord at T12. It's an incomplete injury, so I have some movement in my legs, especially the right quadricep. Now we're doing some work, I'm doing some work with great physiotherapist team and fantastic orthotics team to do some walking. And I've had these built for me, the carbon fibre orthotics, which help give stability, and this one's got a fantastic knee joint. It unlocks and locks depending on where, on the plantar flexion, where my, yeah, that's it.
Hi, I'm Janet. I'm one of the physios in the Victorian Spinal Cord Service. Been working with Tamara in regard to her walking. She's wearing two different types of braces. One on her right leg is just a brace that helps control the movement in her ankle and also provides some support to her knee. The one on the left-hand side is what's called a stance control knee and ankle foot orthotic, and what that does is allow Tamara to have a straight knee or a locked knee when she's standing on it, but also allows it to bend when she's swinging it through. And the advantage of that is such that she's not using as much energy in her walking. She is using a lot of energy, a lot more than you would normally, and having to use her arms a lot to substitute for the lack of some of her leg muscles. She does actually have some good strength on her right-hand side and some muscle strength on her left, but not against gravity. So the orthotic on the left allows her to bring that leg through and be stable, but also to bend it at the same time. Tamara did a huge amount of work earlier or late last year. She got her definitive orthotics, and we've been working with those since. We've been working in the walking hoist track just to act as I guess a catching in case her knee collapses, and we had a few issues with that to start with, but that's vastly improved and Tamara's doing really well with that now. And then doing probably one of our longest goes without the hoist on, and trying to integrate some turning, because obviously life is not in a straight line. We don't walk in straight lines all the time, so we need to be able to turn corners and move between furniture. So we're just starting on that process. We have a clinic that is run with a consultant, medical consultant, an orthotist and a physiotherapist, and that is, I guess, where we often assess down the track if there's any possibilities of orthotics or things that might be appropriate to help somebody into standing, or whether there is a possibility of doing some walking as well. And that will vary from person to person and depending on what muscles you do and don't have working for you. I guess sometimes that is also a process that can happen down the track. You might find that you have had some improvement in the strength and control that you have in your legs, and that's certainly something that can be looked at down the track.
There's so much going through your mind when you first have your injury. It's a bit different now. Like when you get out into the real world and things change heaps, and yeah, you realise that actually there are so many different things that you can do that you weren't told about, and yeah, it's a lot different.